We are now on the final part of our lecture on the autonomic nervous system. In part 3, we will complete our pathways for the sympathetic nervous system and have an overview comparison of the two. Our next pathway is going to the walls of the trunk. We need to get to the skin and blood vessels of the muscles of the walls of the trunk, as well as the skin of the walls of the trunk. Our preganglionic neuron cell bodies will be in the lateral horn anywhere from T1 to L2, depending upon where we are going. Because we're talking the walls of the trunk, these pathways are going to follow our dermatomes when going to the skin. Upon entering the sympathetic trunk, so we've started in the lateral horn, gone out the ventral root, entered the spinal nerve, gone to the ventral ramus, and then entered the sympathetic trunk through the white ramus communicans. The preganglionic axons will synapse with a postganglionic neuron. The postganglionic neuron will leave the sympathetic trunk through a gray ramus communicans, re-enter the spinal nerve, and then will follow either the dorsal ramus or the ventral ramus, depending upon which part of the trunk they are going to. If the nerve is going to be innervating sweat glands or arterioles of the skin or intrinsic muscles of the back, it will take a dorsal ramus to get there. So the skin on the back of our trunk and all of the intrinsic muscles of the spine are innervated by dorsal rami of spinal nerves. So this is how the sympathetics also get to the blood vessels supplying those structures and the sweat glands of the skin. But if going to the anterior or lateral aspects of the trunk, then the sympathetic postganglionic neurons will take a ventral ramus, because it's the ventral rami that innervate the skin on the anterior trunk and lateral walls of the trunk. And it's the ventral rami that innervate the muscles on the anterior aspect of the trunk. If we're going to a dermatome or going to an area that is above the level of T1 or innervated below the level of L2, for instance, if we get below the lower back, we're starting to get innervated by L3, 4, and 5. Then we're going to have our preganglionic axons either ascend or descend in the sympathetic trunk prior to synapsing. But if we are going to areas that have a dermatome or a myotome of T1 to L2 or possibly L3, there's no need to ascend or descend. They will simply synapse at the same level where they are located. So we'll draw out our picture of going to the walls of the trunk. Again, I want you, like the previous part, I would like you to add in all the additional labels to make sure your entire image is labeled for study purposes. So we start out in the lateral horn of the spinal cord, somewhere between T1 and L2 or L3, exit the ventral root into the spinal nerve, into the ventral ramus, into the white ramus communicans, entering the sympathetic trunk, synapsing with a postganglionic neuron within a paravertebral ganglion. The postganglionic neuron sends its axon out of the sympathetic trunk through the gray ramus communicans into the spinal nerve. And then in this case, I'm going out the dorsal ramus. So this particular nerve must be innervating sweat glands or blood vessels on the back side, so on the posterior trunk. If I were to have that postganglionic neuron go out the ventral ramus, then I know it would be innervating sweat glands or arterioles that are on the front side of my trunk. Our next pathway is to the abdominal and pelvic viscera. Our starting point for our preganglionic neuron cell bodies is in the lateral horns of the mid to low thoracic levels and the upper lumbar levels. Essentially, pelvic viscera is going to be low thoracic, upper lumbar, and abdominal viscera will be more the mid to low thoracic. The axons are going to leave the spinal cord through the ventral root, enter the spinal nerve, go to the ventral ramus, into the white ramus communicans to enter the sympathetic trunk. But now they're going to do something that is very different from all other sympathetic neurons. They're going to leave the sympathetic trunk. So essentially they just pass through it without stopping. They pass right through the sympathetic trunk and travel in the sympathetic abdominal pelvic splanchnic nerves to ganglia that are located on the ventral surface of the abdominal aorta, the prevertebral ganglia. It is here that they're going to synapse with a postganglionic neuron. So the preganglionic axons synapse with their postganglionic neurons in a prevertebral ganglion. It is called prevertebral because it's anterior to the vertebral column. The others are paravertebral because they are next to the vertebral column on either side. The postganglionic axons then leave the prevertebral ganglia and follow branches of our abdominal aorta to get to the target organs. You are not responsible for this information. I simply have it included in case you have a patient where they are dealing with some of the sympathetic innervations of the abdominal pelvic viscera, and you needed a little bit of a reference to go back to see if you see, say, a specific ganglion discussed. You would have an idea of what this ganglion is doing. So we have different abdominal pelvic splanchnic nerves. I'm not asking you to know them. Just know abdominal pelvic splanchnic nerve. You do not have to know them by their individual names of greater, lesser, least, and lumbar. Likewise, you do not have to know the names of the specific prevertebral ganglia. Just know them as prevertebral ganglia. But again, you might see in documentation reference to the celiac, the superior mesenteric, the inferior mesenteric ganglia. So now let's draw out our pathway going to the abdominal pelvic viscera. Make sure to add in all the additional labels as you go along. So we're going to be starting in the mid to low thoracic spinal cord, or if we're doing pelvic viscera, we could also be in the upper lumbar levels of L2 or L3. We're starting in the lateral horn, exiting via the ventral root into the spinal nerve, into the ventral ramus, into the white ramus communicans. We enter the sympathetic trunk and immediately exit the sympathetic trunk, then travel in the sympathetic abdominal pelvic splanchnic nerve. Synapse in a prevertebral ganglion on the ventral surface of the abdominal aorta, and then follow branches of the abdominal aorta to get to the target organ. In this case, a section of the small intestine. Our last pathway for the sympathetic nervous system is to the lower extremity. This will be almost identical to what we saw for the upper extremity, with the exception of we are going to have to descend in the sympathetic trunk rather than ascend in the sympathetic trunk for the majority of our neurons. The preganglionic neuron cell bodies are in the ventral horns of L1 and 2 and possibly L3. We're going to take the ventral root to the spinal nerve, to the ventral ramus, to the white ramus communicans to enter the sympathetic trunk. Once inside the sympathetic trunk, most of the neurons are going to descend to get to a paravertebral ganglion that is closest to the spinal nerve that the postganglionic neuron will be taking to get to its target. The preganglionic axons will synapse with the postganglionic neuron in the paravertebral ganglion. The postganglionic axon will leave the sympathetic trunk and enter the spinal nerve via the gray ramus communicans. It will follow the spinal nerve into the ventral ramus and then follow the ventral ramus into the lumbosacral plexus. And it will take a branch of the lumbosacral plexus to the target organ. We'll now draw out our final pathway. Please make sure, as with the others, to label all structures as we did in the very first picture, so that for each image you have a complete labeled picture to study from. So we're starting in the lateral horn of L1 to possibly L3 levels of our spinal cord, to the ventral root, to the spinal nerve, to the ventral ramus, to the white ramus communicans, into the sympathetic trunk. Most likely will descend in the sympathetic trunk to a more inferiorly located paravertebral ganglion, synapse on the postganglionic neuron, whose axon leaves the sympathetic trunk through the gray ramus communicans, enters the spinal nerve, goes to the ventral ramus, and then follows the ventral ramus to a branch of the lumbosacral plexus to get to the smooth muscle, either within the blood vessels of the muscles of the limb, the blood vessels of the skin, or the smooth muscles of the glands or the hair erector muscles of the skin. And here we have our summary comparison of the pathways of our two systems. The preganglionic neuron cell bodies in the sympathetic system are located in the lateral horns of T1 to L2 or L3 levels of the spinal cord. The parasympathetic neuron preganglionic cell bodies are either in brainstem cranial nerves 3 oculomotor, 7 facial, 9 glossopharyngeal, or 10 vagus, or in the gray matter of the sacral spinal cord at S2 to S4. The postganglionic neuron cell bodies for the sympathetic nervous system are located in either paravertebral ganglia of the sympathetic trunk or prevertebral ganglia on the ventral surface of the abdominal aorta. In the parasympathetic nervous system, the postganglionic neuron cell bodies are within intrinsic ganglia located either in or near the wall of the target organ. Our sympathetic nervous system utilizes short preganglionic but long postganglionic neurons. In the parasympathetic nervous system, it is the reverse. We have long preganglionic but short postganglionic neurons. Our sympathetic nervous system tends to give more diffuse response with a ratio of 1 to 20 preganglionic to postganglionic neurons. Parasympathetic, much more focal with a ratio of 1 to 2. The general effect for the sympathetic nervous system is fight or flight, emergency type response. The parasympathetic system is to regain homeostasis, rest and digest. And then the pathways utilized by the two systems. The sympathetic system utilizes branches of the carotid arteries if going to target organs in the face region and head, the cardiac nerves to the heart, the thoracic visceral nerves to the respiratory system, spinal peripheral nerves if going to the trunk or the limbs. If we're going to the limbs, we're going to utilize the brachial plexus and the lumbosacral plexus. If going to the trunk, we'll utilize dorsal rami and ventral rami and the coccygeal plexus. Preganglionic sympathetic neurons will travel in the abdominal pelvic splanchnic nerve if going to the abdominal and pelvic viscera, with our postganglionic neurons following branches of the abdominal aorta. For our parasympathetic system, cranial nerves 3, 7, 9, and 10, oculomotor, facial, glossopharyngeal, and vagus all take parasympathetic nerves to the smooth muscle in the face region, the thoracic viscera, and the majority of the abdominal viscera through the level of the transverse colon. The pelvic splanchnic nerves emanating from the spinal cord carry the remaining parasympathetic nerve to the abdominal viscera after the transverse colon and the pelvic viscera. You have a handout within your course packet that describes the actions of the sympathetic versus the parasympathetic nervous systems. You will be required to know these different actions. So make sure in addition to knowing the pathways, that you also understand the actions that would occur by stimulating the sympathetic nervous system as opposed to the actions that would occur by stimulation of the parasympathetic nervous system. For example, understanding the sympathetic nervous system will increase heart rate and contractility, whereas the parasympathetic nervous system through cranial nerve 10 vagus nerve will decrease heart rate and contractility. If you have any questions on what you are expected to know regarding the autonomic nervous system, please make sure to post it on the discussion board.